The Biden administration is trying to step up the fight against the fast-spreading Omicron variant. That includes increasing access to testing. Americans with private health insurance can now be reimbursed for 8 at-home COVID tests per month. And starting Wednesday, people will be able to order free tests through the federal government. Meanwhile, the CDC is urging Americans to wear the most protective masks that they can find. For most people, that would be an N95 or a KN95 mask if you can find them. Omicron cases are still climbing in some parts of the country. Florida is now the third state to pass 5 million total COVID cases during the pandemic. And as of Friday, the U.S. is averaging more than 780,000 new cases and over 1,600 deaths every day. There is a sign of hope in New York City. Cases on Friday dropped by 47% from the previous week. The governor says the state is turning the corner on the winter wave. Joining me now is Dr. Jeremy Faust, emergency physician at Brigham and Women's Hospital and an instructor at Harvard Medical School. He is also the author of Inside Medicine on Bulletin.com. Dr. Faust, welcome back to the show. So there is some good news there out of New York with those declining cases. Are you seeing a similar trend in the Boston area?
Thanks for having me back. And yes, we are seeing that sort of trend. I tend to think that we too often think of this as we are passive participants, like these are waves of weather that we just have to wait out, when in fact, it's our behavior. We participate in what happens, and our behaviors matter so greatly. I don't think it's at all a coincidence that the peak number of cases in Boston, and I think around the country as well, was January 12th, 2021, and then now this year, January 11th, 2022 was the peak. So I think that we gather for Christmas and the holidays, we make choices, and unfortunately, there are consequences to those choices. On top of that, there's some weather component, there's of course vaccinations. So yes, I love to see the drop in cases. We are seeing it both in our testing and in our wastewater here in Boston, but I put out to everybody that we control this more than we may realize.
The Biden administration announced a plan that will allow Americans to order free COVID tests through the government. But experts say the lack of testing up to this point has hobbled the coronavirus response. What improvements do you think need to be made before another possible variant strikes?
It's a very important question because we never know what's coming next, and that's why predictions are trouble. What I have been talking to officials about for such a long time now are the what-if scenarios. People like me sit around and think, well, what would we do if something bad happens? For example, what if our vaccines were not as effective as they currently remain? Would we have to shut down? Would we have to go back to those dark early days? With rapid testing and also a lot of other forms of testing, the PCR testing that takes a little bit longer, we now do have the ability to track these outbreaks so that we don't necessarily have to take such extreme measures when an outbreak happens if we use our testing capacity wisely. So I think that the rapid tests being available to the public for cheap or free is an enormous step forward in our ability both to keep people in our community safe who cannot afford to get any infection, and also in our ability to keep life going as normally as possible. I don't think that either extreme is correct. I don't think we need to be hunkered down and locked down, and I don't think that it's appropriate to pretend this doesn't exist. Rapid testing and other forms of testing can really help us thread the needle appropriately and keep everyone as safe as possible.
And Dr. Faust, experts are starting to warn about potential future COVID-19 variants. How should we prepare for that? And how concerned are you?
I think that future variants are inevitable. Viruses mutate, and they mutate when they have the chance to do so, which is while they're infecting us. While they're making copies, they make mistakes in their copies. Those mistakes can be beneficial to the virus in terms of its ability to spread. Unusual that a mistake in the virus or change in the virus's genetic code would cause a major change in disease. That can happen. We've seen that. But it's more likely that a future variant will be very contagious, just like Delta was, just as Omicron is. But I don't necessarily think that we have to worry about a future variant causing worse disease, but it could happen. So we have to watch this very carefully. What I am happy to see happening is that we are learning so much. We're getting so much better, scientists are, at looking at a new variant, saying, is it of interest? Is it of concern? What features does it have in the laboratory? And then we can look in how it behaves out around us. but learn quickly so that we know the implication of each new variant. We're going to have new variants. They're going to make headlines. Some of them are going to end up being less concerning. Others are going to cause problems. But the better we get at tracking and reporting, then the sooner that we can know what we're dealing with and respond. So I'm pessimistic on one hand. We're going to have more variants, but I'm optimistic that we are learning more and more how to deal with that appropriately. And we've got these vaccines that are just still miraculously performing miraculously and keeping so many people safe.
Sure, but those vaccines still aren't approved for children 5 and under. By the time they're approved, do you think we're going to need new vaccines that are better suited to newer variants of the virus? And for parents who have young children, is there anything in particular that you would advise them to do?
You're so right that under 5 group is really one of the major remaining issues that we have. We also have the issue of younger adults who are under-vaccinated or unvaccinated. Pregnant women, for example, absolutely are an under-vaccinated and under-boosted group. Under 5 is just tremendously important. When we think about the fact that we've had 1,000 children die in this country under the age of 17, 1,000 Americans under the age of 18 have died of coronavirus, that's just astonishing to me. And the fact that we have 850,000 deaths in this country total sometimes makes us think that, well, it's 1,000 children, that's sort of a smaller number. But 1,000 children, that's an incredibly high number. If no adult had ever died of coronavirus and it was only 1,000 kids that had died, we would be still thinking of this as a crisis. Now, I'd be correct. Look, 1,000 kids, that's not a rounding error. These are children, and they have lives to live. So it's really tragic. I think that the sooner that can happen, the better. We need to have the safe data. The Pfizer trial was a disappointment, but that's okay because that's what science does. It asks a question and gives us answers, and then we move on. I hope that we'll have Moderna and then Pfizer giving us better news soon so that I can get my 3-year-old vaccinated so that we can get back to life. For so many of us, the return to normalcy is really wrapped up into who is the person in your orbit who you can at least afford to see get sick. And with so many children still at risk, I understand why parents are still reticent to sort of pretend that this is not happening still. So I think we still have to wait for those new vaccines.
And in the meantime, it's masks. And on that front, the CDC has issued new guidance. Are you recommending to patients or friends and family that they really stay away from cloth masks and use the N95s, the KN95s all the time when they're out now?
Something is better than nothing. I always want to just emphasize that whatever you can do, please do that. If you can wear an N95 in densely crowded situations, you definitely should. I think watching what doctors do is a very good indicator of what should happen as opposed to necessarily what guidelines say. Early in the pandemic, I didn't wear a mask in the first month or so, or during early March, because we didn't understand to what extent this virus was in the air. And then when we realized that, I started wearing a mask. And then when later on we started to have more contagious variants, I started to wear a better mask when I was at the grocery store, let alone with patients where we always would wear something like an N95 or with our PPE. So yes, we are learning that masks matter, that the quality of masks matter. Something is always better than nothing. I'd rather have somebody do something that they can do, though, than sort of toss it out and say, well, if I can't do 8 hours a day of N95, then throw the whole thing out. I'm just going to take my risks. We can do it gradually depending on the person. And I myself pick my battles. So I think that the updated guidance is appropriate, but I understand why people are confused, and we're still trying to learn. So I understand that people don't love bearing with us as we learn, but that's what we're asking them to do.
Dr. Faust, the Supreme Court has upheld the Biden administration's requirement that healthcare workers be vaccinated. And many hospitals are now bracing for staffing shortages, especially in states that didn't have vaccine mandates previously. Are you worried about these shortages further stressing the system?
Shortages are a huge deal. When you look at hospital capacity, it's not just the beds, it's the people to take care of the patients who are in those beds. So the workforce is everything right now. And we saw that in New York, where we had thousands and thousands of young people getting Omicron, but fortunately they were vaccinated or they were low risk. And so the only thing that happened to those people were they were sidelined and they couldn't go to work and do really important things like going to be hospital workers or doing whatever other jobs that we rely on to live our lives. So that's a huge, huge problem. I tend to think that this narrative that vaccine mandates scared out a small percentage of healthcare workers who wouldn't go along with it. I think that's a little bit misguided. And I don't think that's the argument you're making, but others have made it. Because the flip side is actually probably more true. I know so many healthcare workers who have healthcare risks themselves and who are nervous about getting infected. If there weren't a vaccine mandate where they work and treat patients, they wouldn't feel safe to come to work. We'd lose great doctors, nurses, and other healthcare providers because mandates aren't there. So I actually worry that we lose just as many, but a lot of the oxygen gets taken up by people who are kicking and screaming about a mandate. I'm disappointed in the Supreme Court's decision. I'm not a legal scholar, but I will say as a public health professional that I believe that those mandates save lives, and I wish that the law was interpreted in a way that would allow us to do that. So it's a setback, but I think that hopefully more and more people are realizing the importance of these vaccines. Look, Omicron has caused an interest in vaccines, so people are going to get them. We need more sooner. I wish the mandate were there, but we have to work with what the ground conditions are. So if anyone has questions about vaccines, please ask the people you trust in your life, and hopefully we'll get you to yes.
All right. Dr. Jeremy Faust, thank you for joining, and thank you for all that you do.
Thank you.